So, good afternoon, everyone, and welcome to this expert panel discussion on digital healthcare in Africa, challenges and opportunities. We have four of our five panelists with us at the moment, and in a short while, I'm going to ask them to introduce themselves very briefly to talk about kind of work that they do in the organization that they work for and their interest in healthcare in Africa. To introduce myself, for those who've not had any contact with me before, I'm David Wordley. I'm Vice President of the International Society of Digital Medicine. And on their behalf, I'm organizing a series of events and virtual activities which are designed to share expertise of clinical professionals from around the globe. So welcome everyone. I'm now going to ask each of the panelists in turn to briefly introduce themselves. So I'll start with Mary Akangbe and just ask you to say a few words about yourself, about Zenith Global Health, and what your interest in healthcare in Africa is.
Hi everyone, thanks David for this once again. My name is Mary Akangbe and a friend and ally of this platform actually. I'm a specialist practitioner in minimally invasive surgery, robotics and genomics. And I'm also the founder president of Zenith Global Health. And I've been in this space of health technology, minimally invasive surgery for about 25 years now. And our focus in Zenith Global Health is design management, support for instruments and equipment, teaching, training, mentoring, and capacity building. And on the back of that, with our work in collaborating with countries and institutions across the globe, especially in the sub-Saharan Africa, we started the Zenith Global Health Awards 5 years ago. And we have people from all over the world as well coming to celebrate each other, acknowledge each other, and then benchmark and collaborate on different aspects. And we've seen many partnerships developed from that. My focus really is ensuring sustenance and background education and knowledge for digital health, and also to ensure access and inclusion, basically. Yeah, so that's me in a nutshell.
Okay, thank you very much for that, Mary. I'm now going to ask Kumar Utpal to unmute himself and say a few words about himself and the organization that he works for and his interest in healthcare in Africa. You're based in Saudi Arabia, Kumar. Just say, sorry, you're based in Johannesburg, Kumar. Just say a little bit about who you are and what you do.
Sure. Thanks, David. Thanks for this opportunity to be in this esteemed panel. It's great to actually talk about healthcare. So I am Kumar Utpal. I have been in financial services, insurance, and healthcare industry for last 18 years. I have been working in 3 different continents, which is Asia, Australia, New Zealand, and Africa. So I have worked in all these continents and predominantly with technology company, and I have been helping healthcare, insurance, financial services industry with respect to all the innovation that is happening globally and how all these industries can adopt to these innovation and can be better with respect to their customer service, as well as improving their operational efficiencies. So I'm working right now with a company called Into IT Technologies. So Into IT Technology is a South African-based technology firm. We are one of the fastest growing and one of the most innovative technology firm when it comes to emerging technologies such as robotics, IoT, artificial intelligence, blockchain and all. And we do work extensively with healthcare insurance, and financial services industry. So the key message for me to this forum, which is digital healthcare, is how like public sector, healthcare, and insurance industry can work together to create value for people in this continent. And I think this is something that we all have to actually understand, that how technology can be enabler for each and every institution, which with respect to public sector, insurance, financial services, and they can create value for the customer, and also give a kind of like a futuristic approach with respect to giving better healthcare services to all the people in this continent. And that is something that we in Into IT is driving, and that is the mission that I am actually working along with all these institutions in this continent. Thank you.
That's wonderful. Thank you very much for that. I'm now going to move over to Leonard Torsu, ask him to unmute himself and say a little bit about his work and his interests in healthcare in Africa.
Okay, well, it is almost 4 p.m. here in Saudi Arabia. My name is Leonard Torsu. I have worked in the healthcare sector in the UK since 2003. I have predominantly worked in the supply chain or procurement division, managing procurement activities on behalf of the National Health Service in the UK. I've managed over 31 hospitals across London or across the UK. I have worked in Qatar, Dubai, and I'm currently in Saudi Arabia. Now, my experience in healthcare led me to set up a charitable organization called Healthcare for Africa. Healthcare for Africa mandate was to help and support improve healthcare system in Africa countries. And when it was set up, our aim was to secure support from the national health system in terms of medical aid and equipment to donate free of charge to hospitals and organizations in Africa countries. We have done that through partnership with other organizations like Synergy Healthcare and other corporate organizations. So in brief, that is me really. I'm currently building a clinic for deprived people in Ghana from my own resources, by the way. The clinic project is almost complete. And I've also started a pharmacy project in Ghana as well, which is also portesholo.com pharmacy project. That's a brief of me. Thank you very much, David, for organizing this meeting.
Yeah, thank you very much for that, Leonard. Yours is an inspiring story, as are all of our panelists, and that's one thing that I've noticed about the commitment, the mental and emotional commitment to do something for healthcare in Africa. It's very, very commendable, and I hope these webinars will open some doors for all of you. So now I'm going to go to Dr. Debo Odulana. I think you're speaking to us from Lagos, are you not? Can you unmute yourself? Yes. Could you say a little bit about yourself and the work that you do?
So my name is Debo Odulana. I'm a medical doctor. I'm also the founder and CEO at Dr. I Health Limited. Primarily, I work as a management consultant in healthcare, mostly focused on performance improvement. Of late, most of my work has been on the transformation and the kind of trying to drive the adoption of telemedicine in the different forms. But on the business point of view, I am focused on providing rentable medical facilities for healthcare professionals. Our goal as a business is to make sure we can create a hub for medical tourism in Africa. And we want to do that by enabling health professionals to start their own private practices without incurring so much setup costs. I have some experience from the UAE and also from the UK, and moved back to Nigeria twice actually to just contribute to developing the ecosystem here, as well as trying to reverse the brain drain that is constantly a plague to most African countries.
Thank you very much for that debate. I think all of our panelists have really got an excellent background and credentials to be able to discuss this very important topic. To start the session, what I'd like to do is to just share an infographic with you, which is basically a survey that was carried out on people's opinion of what is the top priority for improvement in sub-Saharan Africa. So this was carried out by PEW Research Centre in 2015. And you can see there on the screen a list of countries and where people thought investment ought to go, or at least where the priorities should be. So you can see that at top of the list, with every single country apart from South Africa, is healthcare. And again, apart from South Africa, it tops education, government effectiveness, agriculture and supply of food, infrastructure such as road and bridges, and supply of energy such as electricity or petrol. So there is already a strong feeling that healthcare is one of the major priorities in sub-Saharan Africa. And what I would like to do to begin with is to ask each of our panelists in turn to give some idea of what healthcare provision is like in the African continent at the moment. So I'm going to start with you, Mary. Can you kind of talk us through what healthcare provision is like in the African continent? What's it like for ordinary people?
Yeah, thanks, David. Even generally, without venturing into digital health, healthcare in sub-Saharan Africa is fragmented and non-inclusive. There's a big divide, but it's no secret, as your survey have shown, that Africa is striving for a digital health solution and innovative way of working as a way forward. But presently, the problem is that most of the solutions are layers upon layers on the problem that is there already. So I believe that we have to dismantle the architecture, if you like, so that, first of all, every digital or telehealth solution will build inclusivity into it. Even the basic healthcare access in, like in telephone, WhatsApp, or whatever, not everyone can afford it. So we have to think, when we are thinking about these solutions, we have to think about what percentage are we aiming at. That's the first thing. The second thing, as Debo has said, brain drain has created a big gulf in healthcare professionals, in number of healthcare professionals across Africa. I mean, if you see the statistics, it's actually disheartening. So we need to focus on education as well, so that the people that we rely on find a way of building the capacity and critical mass for the people we rely on to deliver, and for the people, the population, to embrace and to be able to access whatever solution we are bringing to the table.
Okay, thank you for that, Mary. I'm now going to go on to Leonard and ask him for his views on healthcare provision in Africa. You set up the charity Healthcare for Africa some years ago when you were working in Nottingham. Have you seen many changes or improvements? What's the situation like from your perspective about healthcare provision? Do you go along with what Mary was saying about the inequalities?
I do agree with my panel members very well. My take on that, as a 70 born, I have experienced a lot in the area of healthcare provision in Africa. Especially 2 years ago, my mom passed away just because she couldn't get the right medications or help or support that she needed in Ghana. A lot of medical negligence are happening in hospitals and other clinics. But having said that, in my years in Ghana, where there was limited number of hospitals or clinics in Ghana, having said that, recently visiting Ghana, I have realized that a lot of clinics or private institutions or clinics or hospitals are being set up and are being established. And me, as an example, as I said before, I'm also building a clinic for the poor and the deprived people in Ghana. Now, across board, statistics shows that Africa in whole, as a whole, the gross domestic product, they contribute about 8% of gross domestic product towards maybe healthcare infrastructure project in Africa. That shows that the focus of healthcare facilities in Africa, we need to pay greater emphasis and greater focus on healthcare provisions and health or facilities in Africa. Not only that, we can also look at the infrastructure. There's a low level of infrastructure in Africa. For example, in Ghana, for example, if someone is living in the northern part of Ghana and has just appendicitis and needed maybe an urgent care and urgent operation, that person would have to travel maybe 2 days or 3 days to the city center before they can operate on such a person. Just imagine what will happen on the way. The person will die. There's also lack of logistics and supply chain network in Africa continent. Coupled with, I was so shocked when I saw corruption being 6% in Ghana. Corruption is also one of key ingredient of that deprive the people from setting up healthcare facility or from people accessing good quality healthcare system in Africa as well. So in paying attention to the improvement of healthcare in Africa continent, we also need to also look at how we can combat corruption, because you have partners willing to invest in Africa, willing to maybe bring infrastructure or telemedicine or improve medical system in Africa, but only to be faced with politicians looking for ways and means to make ends meet in terms of taking the money into their own pocket. So it is also very key to focus on how to combat corruption in order to improve the healthcare system in the African continent. Now, focusing on healthcare for Africa as a project which I am passionate about, it was brought about as a result of the inequalities in the healthcare system in Africa. So my aim was to look at how best I can also support the African healthcare system by partnering with NHS organizations in the UK who will donate medical equipment for me and also to donate to the African continent. And I have done that the past 5 or 6 years ago. I donated to Nigeria, I donated to Kenya, I donated to Uganda, and I've also made a donation to Ghana as well.
Okay, thanks very much for that, Leonard. You raised some interesting points there. I'm going to shift now to Kumar. I came across Kumar because when I Googled healthcare in Africa, I came across an article that Kumar wrote which talked about healthcare in Africa and some of the problems. Would you like to just kind of see what you see as some of the main issues in healthcare?
Yeah, sure. Thanks, David. Yeah. So like, from my perspective, because I'm living in Africa for last, I would say, like 6 years, but I've lived in Africa for more than 7 years now. And my perspective is very, like different, because I've not seen the healthcare facilities the way like in other panel members have seen, because I've not grown up in this continent. But I'll share my perspective with respect to other country, and I will try to bring some kind of cluster into this whole conversation. So what happens is the public sectors, so I would say government in other countries, for example, some mature country like Australia, New Zealand, if you go to some Asian country as well, the government is very efficient with respect to providing healthcare to people. What I've observed in certain Asian countries, including India, the healthcare facility is completely different than in the globe. So when I see Africa as a whole, what I see is there are there are private sector healthcare practitioners, there are public sector, like hospitals and all these healthcare facilities, and then there are alternate way of providing healthcare, services, which might be funny sometimes, but it is actually quite prevalent in this continent as well. So the thing is, what is happening with public sector is the way public sector is run, and I'll be agreeing with Mr. Leonard here, that there are some set of irregularities as well as corruption that is driving that sector, and that is why that sector is not able to provide the required or even the minimum healthcare service that is actually should be given to people. Private healthcare, on the other hand, are very sufficient, but it's extremely expensive and it cannot be afforded by normal people. So that's the thing. And then third one is this alternative way of solving a lot of problem, which is actually growing globally quite extensively. And I would name it like naturopathy, then homeopathy. In India, we have, because I'm from India, we have something called Ayurveda, which is another way of solving, problems, which is quite significant and quite big as an industry. So I've seen Africa has these three different, way, I would say, cluster of healthcare services, and the biggest gap in this is, adopting to technology. I think most of the places, and that is where I have written this article, where I have not seen, there is no central database of practitioners, there is no central database of patients, there is no central database of places where you can actually go and get your healthcare. And that is the biggest gap that I see in this continent. So what happens is, for example, if let's suppose I move from one city to other city and I have been visiting one doctor for some treatment, and that treatment has been happening for longer period. Now I move to another city, that doctor does not have any record about me. So that I have to do entire treatment maybe again in order to get to the point where I left in one city. So I think this is something that is a biggest gap, and this gap can be easily solved by technology. Only thing is, public sector and private sector together has to work in order to solve this problem. And this can only happen through technology. Globally, if you see, majority of mature country is actually, trying to bridge the gap between insurance company and public sector. And they have actually seen that you can actually save more money by just having this whole centralized database of everyone. And this is the way you can actually solve a lot of problem. But unfortunately in this continent, this is not being, adopted, as well as I think even government is not very keen to do that. I'll just give an example of South Africa. They are starting national health insurance here, which can actually give some kind of basic minimum treatment to every individual in this country. But I think this whole initiative is going on for last many years, and no one knows where it is right now. So the thing is, I think this is more or less case everywhere. So I would say that, public sector, private sector, as well as insurance company has to join and work together. And then they can create this whole sustainable and inclusive healthcare service for everyone, which is very much important. Maybe later on, I'll also touch upon some of the great initiative that is happening from technology perspective across the globe, so that all the fraud and all the leakages that is happening in healthcare industry right now, which is the biggest problem. And if I just give you the number of leakage, it globally, and obviously Africa includes contributes to most of it, is $19 billion a year. That leakage is happening because of irregular practices and not having technology in place. So that is what my submission will be here.
Thank you very much. Well, I'd like to go to Dr. Debo Odulana now, because when I spoke to him before this webinar, he was telling me about his experiences working as a practitioner in a private hospital in Lagos, I believe. Can you just share a little bit of what you told me, and maybe give some of your views about the issue to do with corruption and misspending of money?
Thank you very much. I think it's, again, really exciting to be here as one of the panelists. Very important contributions by the other panelists, and I will just go on to add to what they had said. And a very good angle coming from Kumar as well with regards to the inefficiencies. Obviously, from the insurance perspective, that becomes a very glaring point to focus on if we're going to increase the throughput for the limited resources that we have. So I think to start with, I would like to just share a general overview of how the structure here currently is. And starting by saying that we currently have certain structures in place, but these structures haven't efficiently delivered on the objectives of those structures. And by these structures, I mean that we have some decent facilities, we have an overloaded public health system, we have the thriving private sector, despite the private sector being monopolized and kind of focused on the upper class. And then we have a rural kind of majority that are not getting access to quality healthcare services. Lastly, we have a national health insurance scheme as well that has failed to kind of cover more than 5% of the general population. The private insurance providers have also not done more than 5%. So we have a country where insurance coverage is below 10% globally. Most of the people, more than 70% of the consumers of healthcare pay out of pocket. We're losing over $1.3 billion to medical tourism on a yearly basis. And we have a very vast majority of people, over 90 million people, who are not able to spend more than $6 a year on healthcare. So with all those complexities, I found myself as a professional who had returned from working in Dubai, where it's a very resource-rich environment, to working in Nigeria where there was a lot of improvisation. So I had gone through working with the state government in the city, and then working with the state government in the rural region. And then while in those two areas, I had done some private practice as well, and then returning to work at the one of the leading private hospitals in the city of Lagos. What I realized at that time, and what prompted me to go ahead to start my business, was that apart from the fact that there were a lot of inefficiencies in the system, the large private hospitals were able to charge premium for their services and deliver what people would otherwise travel abroad to go get. But these services were not of reach to the lower tiers of the population. Secondly, the same professionals that live in the city in terms of the consultants rotate across the different private hospitals and sell their services at different rates depending on how responsive or how nice or how nicely branded that private hospital is. So it was now a case of, packaging and branding of services as the major difference. And inefficiencies were being transferred to the consumers just as a way of private hospitals and private entities being able to break even because the market was relatively very small. Expanding this market is something that is drastically limited by the health insurance companies. And the health insurance companies are mostly tied to servicing companies. And that is the employers who would kind of pay for the employees as mandated by the new policy. This leaves a lot of informal workers and people in the informal sector out of regular insurance premiums. And that is a gap that currently the states, some states are trying to close by establishing their own state insurance schemes. But there is a lot of gap in terms of the social insurance bracket that should be covered, provided for people who live in the rural regions, who make up to 70% of the population per se. And the consequence of the fact that insurance doesn't trickle down to these populations and these communities is that providers are not encouraged to set up facilities within these communities because there isn't any guarantee that people would pay for services. So essentially down to a cash flow problem. People who can pay cannot afford to attract the high quality providers to come into their areas. We don't have a lot of tax shifting policies to help reduce costs. And as a result, the health services are concentrated mostly to the more urban regions where the richer people can pay for services. And this is what prompted us to setting up our own business to figure out how to get insurance to the underserved regions and at the same time get local services to them. The last thing I want to add that I feel was one of the reasons that led to this situation is that with Africa, we kind of had our pre-existing cultural access at points and ways of accessing healthcare through the herbalists and the local medicine providers and the local workers who helped us, you know, the local vet attendants and all the likes. And then when the missionary came to provide healthcare and that advancement, there was a lot of disconnect, and a lot of people left their traditional and cultural backgrounds to adopt this new sort of healthcare without creating a bridge. And that bridge is responsible for a lot of the workforce shortages that we currently have, because these two systems need to really be communicated to get healthcare from the hospital-based services down to the community. This lack of community to hospital-based integration is another significant issue that we have that digital health can potentially solve.
That's excellent. Thank you very much for that. I'm really encouraged by the contributions that our panelists have made, but I'm also conscious of time, that we have a lot of content to get through in quite a short time. I do encourage our delegates to type in questions into the Q&A, if you would please, rather than the chat. So I'm going to move on now to use some of the questions and comments that have been made to ask our panelists opinions about the difference that digital technologies can make, what the priorities are, and what are the challenges and opportunities that are in Africa. And I'll begin by reading a question from Tim Forsman, who's based in the USA. And he says, how do the panelists view the potential of digital health to leapfrog the health community in Africa against the increasing threats of HIV/AIDS, malaria, COVID-19, and the other basic issues of homeostasis? And what I'd like to do is to just expand this question a little bit into some of my own perception based on experience over the years in community development. And that is that many countries, developing countries like Africa and India, many countries that have fallen behind with the implementation of technologies often find themselves in a position where they can leapfrog. So for example, whereas in my case, I live in a rural community which is really hampered by the quality of broadband, which is a legacy of the old copper wires in the street, many of the new developing countries are able to use smartphones and wireless technologies, satellite communications, and so on. And in many ways, they can leapfrog some of the issues that are still plaguing some of the developing countries. So when it comes to implementing digital technologies, where should the priorities lie? Should we be looking at digital technologies to tackle things like the communicable diseases that are mentioned in that question? Or should we be looking maybe a little bit further into preventative healthcare? And how can digital technologies help with all of these? So I'm going to begin by asking Mary with Zenith Global Health to just share her thoughts on how digital technologies can best support healthcare provision in Africa.
Thanks, David. And yeah, great discussions so far and contributions. Like I said earlier, we need to go back to basics. If we are able to know exactly what the problem is through needs analysis, then we'll know the digital health solution that is fit for purpose for that. And when we think about communicable diseases and innovative way of working, one of the way to bridge that is telecare, personal telecare. What can these people do in terms of diagnosis and awareness? Because a lot of people, especially the marginalized, because I mean, let's face it, like in Africa generally, the first people, the first stakeholders that will embrace anything at all are the people in the private sector. Meanwhile, the vast majority of people depend on the country or states or provinces to, access health. So we have to provide tools for telehealth. For instance, let's take diabetes, for instance, or blood pressure. How can people monitor these things, or even in things that are related to blood? How can they monitor these things to be able to know that, okay, at this point, I'm in danger of? So they access care early. In accessing care early, already we've caught in the birds. And also to be able to know where to go. So there's quite a lot to do. For instance, bringing healthcare to them, or providing training healthcare professionals that will bridge the gap between the doctors, nurses. Like in the UK, we have the doula, for instance. So it's important to have that in place for people to be empowered and actually to see themselves as consumers of health. Because the other thing is, they don't see themselves as consumers of health. A lot of people in the population believe that healthcare is not a favor per se, but is something that is there for them because the government thinks, they are providing this for them. So in anything that we want to do in digital health, it's important to empower the population. And that goes to education as well. Somebody mentioned about e-learning. As an example, when I was in Zambia helping the country to build their e-learning for their medical university through an organization in Switzerland, we said, okay, we'll give the students tablets so that when they are outside Lusaka, in the other provinces where we are building them skills and simulation labs, they can access the videos that we pre-recorded for them of procedures and examinations and things like that. But they were not using it. They were not using them because when we did the survey and realized a good number of them were not using them, they said they haven't got access to data, they cannot afford. So those ones had, I think, SIM card. So they had to withdraw all of those and then provide another set. That then we have to think about, okay, how do we get Wi-Fi to there? How do we get them to and improve utilization? So this needs analysis is very important to ensure cost effectiveness and also to achieve the aims as well.
Thank you for that, Mary. That's some interesting points. I'm going to go to Dr. Debo Odulana now. I'm just asking him for his views on digital technologies, because you're involved in telehealth solutions, and unfortunately one of our other panelists is not able to make it, Henry Etakumo, who's got a mobile application for personal health management along the sort of lines that Mary has touched on. But I've heard it said that one of the issues to do with telemedicine and mobile application with telehealth is that the costs of mobile are so expensive that they are out of the reach of ordinary people. They cannot afford to have an online consultation because they just haven't got the money to use the smartphone. Is this your experience?
Yes. So, like I said when we spoke earlier, and when I was kind of trying to speak, when we do a market segmentation of the healthcare space in Nigeria, we would see very fragmented pockets of opportunities where customers actually have the disposable income. And this is taking out the health insurance companies who are already aggregators. When we go beyond that, we will now see that the majority of consumers actually cannot afford to spend more than $2 to say $10 a month on healthcare. And looking at these numbers and trying to compound, like Mary had said, the cost of internet data, even the doctors themselves don't want to spend their data doing video calls to patients. They also don't want to spend their credits, their call credits, making calls to patients. It's about the same thing, asking the patients to call a phone number to speak to a doctor. And that's going to cost them about 1,000 naira, which is say another $3 to actually have a full consultation with the doctor. This costs become very expensive and just automatically affect the adoption. So if we look at the typical adoption curve for a digital health product in Nigeria, you would see that most products just end at the sort of early adopter phase. Just the innovators and the early adopters, people who can afford those technologies, people who are interested in testing them, and may not necessarily be the best people who really need the services, but they're the ones who have the access and who can afford. If we're going to be taking and breaking that barrier, we need to rethink our approach to healthcare. Like Mary has said, break it all down and take a different model of care. Now, I'll give an example of what we are doing. Now, in the city, I have all the different locations where facilities can be rented. So an Airbnb style setup where doctors on request can rent a facility or book a bed space to admit a patient, or book a dialysis bay, or get a surgical theater to rent to be able to have operations. Then I have a network of doctors as well, and nurses and other professionals. When patients book them, they can easily get services across board. Now that works really in terms of digital health for an urban area, where the majority of what people have said, like Kumar alluded to earlier, what people are looking for, especially services. They want to know, where do I get the next best thing? Where do I get quality? Now, that's a different perspective in comparison to the rural regions. Now, if we look at the rural regions or the semi-urban regions, we're looking at issues of people not even being close enough to a facility, so they can't get the basic care packages. They also don't have access to a lot of call credits or a mobile phone. They're using a feature phone. So we need to think about how to get the healthcare to them, because it's not sustainable to also create new facilities as close enough to them as possible. So it's important that we look for community health workers, other cadres of professionals that can carry the health tools, the digital health tools, and take them on foot to these people. So we need to have a lot of conduits, people who would help us break the conversational barrier. In Nigeria, for example, the other perspective to look at is we're in Lagos. I'm dealing with over 200 diverse languages. Everybody kind of speaks some level of English, but if we're really going to speak to somebody in detail, we need to consider taking the language down, taking the conversation down to his local language. So if I'm speaking to an Igbo person, it would be nice to have an Igbo community health worker to translate to the doctor and do those examinations and use those tools appropriately, because I wouldn't expect somebody who has some low level of literacy to know how to operate this technologies. So having those conduits helps us to bridge the gap, and that might be the effective and critical success factor in crossing over from the early adopter population into the early majority and the late majority, where the masses really are. And in that point, we would now start to unlock other things in terms of frugality and making sure that costs can go lower and services can be delivered to the nooks and trying to get them to.
Thanks very much for that. I'm sorry that time is marching by so quickly. There's just a great conversation going on, and some of the views and ideas that are coming across. I should say, very grateful to everyone who's typed in questions. If you've typed in questions, please don't be alarmed if we don't get around to answering your question, because I plan to share these questions with the panelists after the event, and we will get back to you individually. So Debo made some interesting points there. He really talked about two things. One of the things that he talked about was providing a space and equipment for clinical professionals to use, rather like an Airbnb model that is accessible in urban regions, and then equipping medical professionals with some technology that go out to the villages. We did have a question in from, I think, Jenny Benson, who was talking about non-digital technologies and how they might be used to supplement what's already available. I'd like to go now to give Kumar and Leonard a chance to put their points before we come to a final discussion and address any further Q&A. So what's your view on digital technologies? We've heard about the challenges of cost of infrastructure. Do you think the mobile operators could do a lot more to provide wireless infrastructure that is more accessible to villages, reduce the costs? Where do you think the priorities should lie in digital technologies?
Yeah, so thanks David. Great conversation going on right now. So I would touch upon, and I would like to literally touch upon very quickly, because we are pressed with time. So I would say there are three ways this digital technology can be implemented in Africa. So first of all is solving the problem now. And that can happen with integrated flow of information. So obviously, as I was saying, central database of patients and practitioners, which is working irrespective of public sector or private sector, it has to be across the sector within healthcare, insurance, public sector, and financial services. So that is integrated flow of information, where everyone is able to access, with obviously with all the security measures in place, the right information at the right point of time. So that is number one. Number two, which is the biggest problem in this continent, is how to fight fraud. In order to fight fraud, now there are various technology that is in place, but I would like to touch upon very specifically this one. This is IoT driven, which is Internet of Things driven technology. So imagine a hospital, which is 100% IoT driven hospital. So what happens right now is, if we go to hospital and for a small treatment, you have to pay to GP, then you have to pay to surgeon, you have to pay to different practitioners or whatever it is there within the hospital. But there is no, I would say kind of accountability of how much are you going to pay. So for example, a patient spending 15 minutes with a doctor, or a patient spending 5 minutes with the doctor, or a patient spending half an hour with the doctor is paying same fees, which is not correct. At the other end, if let's suppose surgery is happening. So in the operation theater, okay, there are a lot of equipment that is there in place, but out of maybe 10 equipment that is there in that operation theater, maybe only 3 of them are used. But when you pay bill for everything. Okay, so imagine there is a hospital which is 100% IoT driven. Every equipment has an IoT device. Every doctor has an IoT device. Every patient has an IoT device. And what is happening right now is, while any kind of treatment that is happening in that hospital, the day you enter till the end, it's actually tracked, and each and every information is shared by insurance company. So insurance company is not getting that much of bill that they generally get. And that can actually avoid all the irregularities that is happening within hospital with respect to patient care. And that is something that is completely non-transparent right now. We don't know. We just go to hospital, they give us a bill and we have to pay. Either we pay or insurance company pay. Now, since this whole cost of healthcare is so expensive, normal people cannot afford insurance. Okay, and that's why insurance cost is very high. So imagine hospitals are 100% IoT driven, and it can bring complete transparency with respect to what is happening within that hospital. So that's my second point. Bring IoT within hospitals so that transparency can be brought in and fraud can be avoided. The third one, imagine insurance company running 100% based on artificial intelligence, and all insurance company is actually running straight through processes through artificial intelligence where minimum human interference is required. That will significantly bring down the cost of insurance. And I'm talking about not only private insurance, also public sector insurance. For example, National Health Insurance of South Africa, and any, like in Nigeria, there is similar, entity. Any entity running based on artificial intelligence where minimum human interference is required, and that is where your cost of insurance can be minimum. So within 3 ways, first is solving the first problem, that is bringing centralized database of all the patients and practitioners and having a secured but integrated flow of access of information. Second is just mitigating the risk of fraud by bringing more transparency in hospital by implementing IoT devices there. And third thing, insurance company adopting to more artificial driven straight through processing of insurance policies, and that can reduce cost drastically, and it can be affordable to most of the people in our society.
Yeah, thanks for those comments, Carl. I just make the observation very quickly, not to contradict what you're saying is, but that is certainly a very futuristic vision of being able to solve some of those problems that exist in hospitals. Whether it's something that is practical, bearing in mind our experience in the UK, not to say that there's corruption in the UK, but we struggle a lot with some of our information systems in the UK, which have been developed over many years. So maybe there's a chance for Africa to leapfrog that. I just want to give Leonard a chance just to say a few words about digital technologies and his views on how they can be implemented before we begin to wrap up. So, Leonard, would you like just to make a few comments about what you've heard and the role of digital technologies?
Yes, my colleagues actually have given a lot of response to this. I don't want to take too much of your time, but I'll basically focus on providing an enabling environment before the implementation of any digital or telemedicine technologies that are needed to be implemented. Not only that, we need to also understand what problem the system needs to solve, and also who is going to use the system. And above all, what do we want to achieve from all this implementation? Now, having considered the enabling environment or the strategy, we need to focus on the key problems or areas that actually would prevent the implementation process. And in Africa, for example, we have unstable power. You can implement a very good system in Africa where people can be able to have contact with their doctors and be able to make diagnosis over the internet by use of a good telecommunication system. But if there's no stable power supply, you may not be able to achieve that. So we need to also be looking at how we can be able to address our unstable power system in Africa. Not only that, there is a large illiteracy rate in Africa, and I have given the illiteracy rate to be, let's say, for example, illiteracy in IT to be 35%. So any good provider or partner for digital healthcare or digital technology implementation in Africa need to be looking at how to address the illiteracy rate in Africa. Let's take a recent case study, the recent COVID-19 that we all faced recently, where our children have to be in their homes and they have to be providing online education for our children. Just imagine how many children in Africa were able to access these online or e-learning exercises over the internet. I can tell you for sure that 65% of our children in Africa may not be able to access the basic e-learning that was provided for them purely because they don't have that technology in place. Some typical experiences that I've had, people don't even have the laptop, or they don't have portable iPad. They resort to their mobile phone, and even resorting to mobile phone alone is very limited. Not everybody have a mobile phone. You take, for example, the rural areas, the mobile phone they may have might not be a portable device to be able to access the internet. My colleagues have already talked about the cost of telecommunication as well. Last time we were discussing, and I said, Nigeria has Glo. Maybe Glo might be subsidized, but what about Ghana? What about South Africa? Ghana, for me, who works and maybe regarded as somebody who has, at the medium level, cannot even afford telecommunication when I visit Ghana. People will just switch their data off because they know that when they keep their data on, it will be, the telecommunication company will be actually charging them a lot of money. So any partner or investor who want to invest in digital technology in Africa need to be looking at all these problems and try to find ways and means to address them. My colleagues already talked about corruption as well. Even if you find means to address all these fundamental problems, the government officials are there wanting to take money from you before you can even invest in anything you want to do in Africa. I'm not actually scaring people from investing in Africa. Africa, the maturity of healthcare system in Africa is at a medium level. Africa is ready for digital technology. We have seen experiences in the COVID, and we've seen how they've been able to address them. But there are problems on the ground. So investors need to look at the problems and try to find ways and means to address these problems before even venturing into any partnership work or into any implementation work with any African country.
Okay, thank you very much for that. We are pretty much at the end time of our session. I'm very reluctant to close it because I'm really enjoying this dialogue and I'm learning a lot from our panelists, and I'm impressed by their passion, their enthusiasm, their dedication to do something for the people of Africa. So I'm going to conclude just by asking each of our panelists, give them an opportunity to say, if any of our delegates want to get in touch with you, how do they get in touch with you? And what is it that you would like to say to them? What is you would like to ask of our delegates? What can they do to help to improve the situation in Africa? Just 30 seconds each, please. So starting with you, Mary.
Yeah, thank you. The good news is that right now, a lot of people, a lot of investors in healthcare generally, and of course telehealth, are finding ways to pitch their business, establish their business with less red tape, because I think the government is beginning to realize that instead of making it difficult, they will actually benefit from making it easier. As a consultant for some of the 5 top healthcare providers in the industry, I've seen cases where they have to go through what we call turnkey to get equipment and instruments to the country. And that makes it even more expensive. And also part of innovative way of working, apart from training the people, is to bring healthcare to the people. All right, what we do at Zenith Global Health, where we can help, what people can do, is to look into sustenance, to look into care and handling for these instruments and equipment, education in using them by the people on ground and by the patients that we want to support as well. So you can find us on www.zenithglobalhealth.com. I'm on Instagram, every on social media, LinkedIn, Mary Akangbe. So we can continue the conversation there and see how, you know, we can work together to make a difference in our continent.
Thank you very much for that, Mary. Leonard, Healthcare for Africa. How can people get involved? You mentioned before that you're looking for volunteers. And what would you like to see after this webinar?
Yes, Healthcare for Africa is looking for partnership across the globe. We're looking for volunteers as well. We want to dispatch them to African countries to support the deprived people. We are looking for partnership, and I'll be interested to speak to Mr. Debo and the rest of the panel members as well as to how we can work together as a team to provide our little support for our mothers and children in the African continent. Hospitals donate medical equipment to Healthcare for Africa, and everything they donate to us, we also donate it free of charge to hospitals and organizations across Africa. For the past 5 years, we've donated over £500,000 worth of medical equipment to hospitals and clinics across Africa. So not only equipment, we are also looking for donations in terms of medical consumables. We are looking for partnership work, not only donating, we are also looking out for ways of maybe medical research. We can also represent organizations and individuals in terms of medical research. We have good partnership in Africa. We have grants. We have a lot of grants in Africa. We've also moved into pharmaceutical area. So companies that want to partner into pharmaceutical research or medical research, we are open to hear from them as well. Any company that want to contact me, as these things I do them as volunteer. They're not something that I do that gives me money. My own profession is supply chain consultant. I work as a procurement consultant for government organizations, and now currently in Saudi Arabia, I'm working as a supply chain consultant for organization here in Saudi Arabia. That brings in money. The charity is just a hobby. It's something that I do to support the poor people in Africa. I don't make a penny out of it. I even support with my own personal money. The clinic I'm building up in Ghana, for example, is from my own personal money, and 35% of everything we do will go free of charge to mothers and children who cannot afford basic medical care. I can be contacted on, maybe you can Google portexhollow.com or healthcareforafrica.co.uk, or you can contact me. You can go on LinkedIn and look for Leonard Torsu. You see me, I'm all over the internet.
Yes, if you want to get in touch with any of our panelists, then you can also do it through me. You will have my email from the promotion that we've done before, and I'm happy to make those connections. So what would you be looking for, Kumar? Please, very briefly.
Easiest way to get in touch with me is through LinkedIn. I also own one of the largest LinkedIn group for insurance called Global Insurance Professionals. So please join there. If you wanted to disseminate any information with respect to any initiative or services that you are doing in Africa, I'll be more than happy to disseminate through that group, because that group has very large number of people all across the globe. So that will actually be helpful to let you disseminate information. From Africa perspective, I'll be very happy to get in touch with you through LinkedIn, because that's the easiest way. And we can have discussion, we can have chat, and I'll be very, very keen to be part of your initiative or any support that I can give from an individual perspective or from technology perspective. And one thing I'm looking forward for everyone, that this continent, as David was rightly saying, that this continent has given some of the greatest example of like mobile technology and other things, which has actually like was genesis of this continent. Like M-Pesa was one of the greatest example, and that has actually like given like whole world an idea how mobile can be like part of your financial transaction. So I think this continent has that potential, and I would encourage everyone to come join us in this journey to provide better healthcare, because obviously there are no legacy system that is there in place. So it's a kind of blue ocean for you if you wanted to invest and provide something great to society. At the same time, this continent also gives you a lot of chance to come up with some great value proposition, because the scale of growth is phenomenal, as well as to implement is much easier than doing it in any other country where there is already some legacy system is in place. Thank you.
Thank you very much for that. And last but certainly not least, Dr. Debo Odulana from Lagos. What can we offer? What can our delegates offer you? I need to connect you.
So it's always interesting to collaborate. From this panel already, I've seen very clear.
We seem to have lost Debo. Unfortunately, the connection has been a little bit on and off all the time. So I will apologize on his behalf and say, if you want to get in touch with any of our panelists, please contact me. I'd be very happy to make those connections. Most of the panelists, in fact, all of the panelists are on LinkedIn. I'm very sorry that Henry Atukumo was not able to join us, but the recording of this webinar will be published on the internet later this week, and I'll be copying all of you in. So it just remains for me really to say thank you very much to all of our panelists, and also thank you to our delegates for participating, for your questions. I'm sorry we weren't able to cover all of them during the session, but I will be circulating the questions to the panelists after the event and asking for their comments, and then sharing those with you who've asked the question.